Hello, my name is Roni Shouval. I'm from Memorial Sloan Kettering Cancer Center, and I'm going to talk today about conditioning regimens and the associated patterns of microbiota injury. So this is work we presented at the recent TCT meeting, and the underlying rationale comes from what we know about antibiotic and non-antibiotic drugs and their effects on the microbiome. So there are ample data to suggest and actually show that antibiotics obviously perturb the microbiome. But more recently, work done around the globe showed that also non-antibiotic drugs can affect the microbiome. Typically, we think of a conditioning intensity as the impact of the function of the bone marrow and the depth of pancytopenia. So a higher intensity conditioning regimen is associated with a deeper degree of pancytopenia. But our underlying hypothesis was that not only that conditioning regimens affect the depths of cytopenias, but can also affect the microbiota. And in this work, we aim to study patterns of conditioning-associated microbiota injury in allogeneic hematopoietic cell transplantation recipients. We included approximately 1,200 patients from Memorial Sloan Kettering Cancer Center, which were categorized into one of 8 conditioning regimens. The regimens were also classified by intensity. What we observed is that if you just look at the conditioning intensity groups, so myeloablative, reduced intensity conditioning, and non-myeloablative, the degree of microbiota injury as manifested by diversity drops down more significantly around transplantation with reduced intensity and myeloablative conditioning regimen. Now, interestingly, this injury was independent of antibiotics, suggesting that the actual conditioning regimens have an impact, direct impact, and possibly indirect impact on the microbiome. We next drilled down into the conditioning regimen level. And what we saw there is that indeed most myeloablative regimens had a more profound impact and more profound injury of the microbiota. But some myeloablative regimens, such as fludarabine and busulfan at a myeloablative dose, had a similar degree of microbiota injury as a reduced intensity conditioning regimen such as fludarabine and melphalan. The conditioning regimen, which was associated with the least degree of injury to the microbiome, was fludarabine, cyclophosphamide, and low-dose TBI at a dose of 200 centigrade. This is a regimen we typically use in lymphoma patients. And again, it was associated with the least degree of injury to the microbiome. Not only did we see that the degree of microbiota injury as manifested by diversity is different between conditioning regimens, but we also noted that certain bacterial taxas vary or they alter or vary depending on the conditioning regimens used. In the non-myeloablative regimens, fludarabine, cyclophosphamide, and TBI at a dose of 200 centigrade, we observed a bloom of Akkermansia around peri-engraftment. Now, Akkermansia is an interesting bacteria since it's mucinophilic, meaning it eats mucus, and it has been shown to be protective of several inflammatory conditions, but on the other hand, in the context of transplant, it was associated with increased GvHD. So we are currently looking into that association. As a final step, we looked at the degree of conditioning of the microbiota injury by conditioning and correlated it with intensity. And what we saw generally is that indeed most myeloablative regimens were associated with conditioning intensity by the effect of on the blood counts, but there were some deviations. For instance, the Bumel flu or busulfan, melphalan, fludarabine was associated with less degree of microbiota injury compared to the high-dose TBI with high-dose tiotepa and cyclophosphamide. So in summary, we show that microbiota diversity reduction varies between myeloablative and reduced intensity regimen. We propose a new axis to evaluate allogeneic hematopoietic cell transplantation toxicity, and we think that it could be used in clinical trials and as a benchmark. We are currently exploring the role of acromencia, and I'm sure you'll hear more about it in the future.